Hi, class. Welcome to chapter 11. We're going to be talking about medical conditions involving the cardiovascular system. So, for this chapter, you will have a flow chart, and then there will be quite a few areas to fill in because there are definitely some areas for cardiovascular system for potential medical emergencies that we want to know about. Now, these are medical emergencies that you should have pretty good knowledge of because you've gone over these in like your basic life support courses and CPR classes. So, what are cardiovascular diseases or CVD? Before I do that, don't forget to make sure in chapter 11 that you also review your key terms at the beginning of the chapter. Okay, so cardiovascular diseases can be congenital or acquired. Blood vessel related CVD are aneurysms, atherosclerosis or arteriosclerosis, coronary artery disease, hypertension, and then heart related CVD are things like angina pectoris or chest pain, arrhythmias, congestive heart failure, and myocardial infarction. So, what are some risk factors for CVD? Those include things like smoking, family history of CVD, diabetes mellitus, high cholesterol, obesity, and sedentary lifestyle. Right? So some of these we have more control over than others. And especially things like smoking is something that we encourage patients, right, to stop using for oral health purposes. And then also, nutritional counseling can play into the obesity side of things in encouraging patients, right, to have well rounded diets because that is beneficial for oral health care. But smoking, especially, has a negative effect on pretty much everything. But from an oral health care side, we can help encourage individuals to decrease their risk for cardiovascular disease and also decrease their oral health risks. So, what is angina pectoris? So, angina pectoris is pain in the chest from lack of oxygenation of muscle tissue. This can be associated with atherosclerosis, which is like hardening of the arteries, and inability of vessels to dilate, so they're not able to contract and, what's the opposite of contracting? It causes a diversion of blood flow after a heavy meal. So, your eating can affect angina pectoris, especially potential emergency in the dental office. So, symptoms of angina pectoris can be squeezing pressure or heaviness and tightness or pain in the chest. You can also have like pain radiating to the arms, the neck, and the jaw, and the abdomen. So, if you have a patient that is having that like squeezing pressure, heaviness, tightness, or pain in their chest, it could be angina pectoris. And we have things that we can help in the case of an emergency with that. So, for angina pectoris, of course, we want to try to prevent, right? If we know that a patient has angina pectoris, especially if they know that they have this, they may carry around some medication that we'll talk about that can help if they experience an emergency in related to angina pectoris. So we're going to maintain stress reduction protocols, right? Keep appointments short, keep appointments on time to reduce anxiety for a patient. Use adequate measures to prevent pain, like nitrous oxide, or just not general anesthesia, local anesthesia. Because if individuals are in pain, then that increases their stress. And then we may consider use of pre-treatment anti-anxiety medication that we've talked about before. Of course, anti-anxiety medications, as dental hygienists, we cannot prescribe those, But if we work at an office with a dentist, the dentist may prescribe those, or a patient may take them themselves if they know that they get a lot of anxiety from coming to the dentist. So, what if your patient has angina pectoris, right? They aren't experiencing an emergency necessarily, but what if they do, right? So, what if they experience that emergency in your chair? So, we're going to reposition them to an upright position, of course, making sure they're comfortable, like we always talk about. If they don't want to be totally upright, then maybe semi supine. We're going to reassure the client and maintain our own composure. We're going to measure and record their blood pressure and their pulse, especially if you have an automated blood pressure cuff. Those can be helpful because it will do both of them for you in one swoop. If their systolic blood pressure is less than 100, then we're going to administer a sublingual nitroglycerin tablet, which they're just these little tiny white tablets, and they're found, we do have some in the medical emergency kit. Now, one thing that's important is that we want to verify that a patient has not taken erectile dysfunction medications, that it's not in their system, because nitro tabs are deadly if a patient has had any erectile dysfunction medication in their system. So this comes back, right, to some of those conversations that we talked about, how to talk about difficult things with patients. In a scenario like this, you're probably going to be quick, abrupt, and straightforward and tell them why you're asking, right? You're going to say, before I give you this sublingual nitroglycerin tablet, I think you're having an angina pectoris emergency, but I need to verify that you have not taken any erectile dysfunction medications that could be in your system, because the combination with this drug is deadly. Like, you just have to kind of put it out there and be blunt about it, because you don't want to risk that, right? So, assuming they don't have any ED medications, going to give them the nitroglycerin tablet. We're going to have that oxygen tank out, right? That number 2 person's going to grab the medical emergency kit and either the oxygen cord or the oxygen tank so we can provide oxygen. And then we can re-administer sublingual nitroglycerin as needed. And then if the pain is not relieved in 10 minutes, we're going to call 911. So we're also, us as the responder, or as the rescuer, or maybe one of our responders, you can tell somebody, like, will you check the time for me? Tell me when it's been 10 minutes. And then, of course, we're going to record the events of the emergency in the dental record. So what about valvular heart disease? Conditions for this can be damaged heart valves, congenital heart defects, a heart murmur, mitral valve prolapse, and rheumatic heart disease. They can have an increased risk for infective endocarditis. And the application for us in practice is that we're probably going to want to consult the clinician's physician prior to oral procedures. And then if they have had an artificial heart valve, they may be on a blood thinner, and we want to check INR values, and then use our digital pressure to stop bleeding, and use a hemostatic rinse if needed. Now, if they have had an artificial heart valve replaced, then we're definitely going to have a consultation with their physician, because they most likely are going to need a pre-medication, which we talked about in a previous chapter. Now, I will say, though, for all of these, you are not necessarily going to have a consultation with the physician. Like a heart murmur, mitral valve prolapse, rheumatic heart disease, these things you're going to talk with your patient about. If they're unsure about things or seem confused, then I definitely would do a consultation with a physician. You can also discuss things with other healthcare providers in your setting, right? If you are uncertain of whether you should check up on something. Also, sometimes patients will come in with information from their doctor already, so that can always be really helpful. So, what about a cardiovascular stress? Like if somebody experiences this, right? So, signs and management of cardiovascular stress are perspiration, nausea, shortness of breath, pressure in their chest. Management is performing basic life support if needed, providing 100% oxygen, and calling 911 if not resolved. And that would probably be something that we'd call 911 pretty quickly on if it wasn't resolved, because we don't want to take that risk with something cardiovascular related. So then we just have heart failure. The clinical syndrome characterized by heart failure is dyspnea, fatigue, and edema. There's a reduced output of oxygenated blood, and there's a failure in the left ventricle of the heart. So we do have the heart failure classifications. An A is a risk for heart failure. B is structural heart disease. A C classification is structural heart disease with symptoms of heart failure. And then D is advanced structural disease marked by symptoms of heart failure. Now, the importance of these classifications is if a patient lets you know that they have heart failure and they fall into these classifications, then this determines on what kind of care we provide them or not. So, a class A and B heart failure, we're good to go. We can provide elective care is fine. If they are a class C, we want to make sure that we have a medical consultation, and this care may be delivered in a hospital setting. Class D, we're not going to provide any elective treatment, and an emergency treatment is going to be in the hospital setting. So when you look back at these classifications, right, like A and B, we can care for them as usual. C and D are most likely going to happen in hospital settings. In these classifications, I mean, the likelihood of them being a dental hygiene scenario is less. Sorry, my dog is barking. So, we're going to monitor vital signs, right? Including pulse and breathing, of course. We're going to observe respiration sounds. We're going to keep our patient in a semi-upright position. And then we're going to use stress reduction protocol and have supplemental oxygen if needed. And nitrous oxide can be good too for that stress reduction protocol. Plus, then you have that oxygen on hand that you can implement that right away. So, what if we're managing acute pulmonary edema in clients with heart failure? This is if somebody's having like a rapid pulmonary edema. They may have a dry cough, wheezing, suffocation and anxiety, increased respiration rate, and hyperventilation. Now, as you notice, these symptoms, especially like increased respiration and hyperventilation, can be a symptom of just hyperventilation. But this is if you have a patient that has heart failure, right? So you may treat them differently. Right off the bat, we're going to call 911. We're going to place them in an upright position, provide basic life support if needed, 100% oxygen, and then we're going to monitor life signs every 5 minutes and record. And then we can utilize sublingual nitroglycerin. And I forgot to delete this because in the book it talks about only having the dentist deliver this. However, in Colorado, dental hygienists can also deliver nitroglycerin in certain settings. So it's not necessarily just the dentist. But that can vary by state, so you need to know your Practice Act and rules and regulation. Now, the big one whenever we think of cardiac, right, is a myocardial infarction or an MI, which is a heart attack. And this is the lack of oxygenated blood supplied to the heart, or ischemia. It's caused by atherosclerosis, vasospasm, or thrombotic blockage. Results in death of heart muscle tissue. So management of a client with a history of myocardial infarction is that we don't provide elective oral care within a month, right? 4 weeks after an MI. We're going to evaluate them for functional capacity, ask them follow-up questions, and we're going to determine the risk for future myocardial infarction. And then they may be on an anticoagulation medication, right? So we're going to be either asking for those INRs or doing our 3-teeth test, the probing or scaling to make sure that we're not having excessive bleeding that could be problematic for the patient. Now, what again if they have the acute myocardial infarction? So if they experience a heart attack in the dental office while you're caring for them. So symptoms can be a squeezing in the chest, pain radiating to the arms, neck, back, or jaw, which what do these sound similar to? An angina pectoris, right? So that's where sometimes it can be a little confusing, right? But we can still administer nitroglycerin to a patient if we're unsure if they're having an MI or if it's just angina pectoris. So nitroglycerin is still something we can utilize so we can take care of the angina pectoris if that is, if we're not sure what is happening. Difficulty breathing, perspiration, nausea, hypertension, and feeling of impending doom. So we're going to place them in the upright position. If symptoms are unrelieved, like as soon as you sit them up, we're going to call 911. We're going to place that sublingual nitroglycerin tablet. Again, in some states as a hygienist, you can do that. So you need to know your Practice Act and your rules and regulation. And we're going to make sure that our patient doesn't have any ED medications in their system. We can provide 100% oxygen, monitor their vital signs. You can also have a client chew a 325 milligram aspirin tablet. The chewing part is important. Chew and swallow the aspirin, and then, of course, provide basic life support. So when you have a patient, right, say you have a scenario where your patient is having these symptoms and you're like, I don't know if it's angina pectoris or if they're experiencing a myocardial infarction. If you're unsure and you sit them up and you give them that nitroglycerin tab, call 911. The worst case scenario is that the ambulance comes, they check them out, and nothing, it's nothing serious. It was maybe angina pectoris, which not to say that that's not serious. If they have angina, they can have a higher risk for myocardial infarction. So you shouldn't hesitate to call 911 if you think that it would be beneficial, right? If you have a sense that it may be needed, call them. Especially for our clinic because we are a ways away, they have to park in the parking lot. They got to come all the way across campus. So it never is going to be harmful to have the paramedics show up and be able to say, oh, they're okay. They took their nitroglycerin tablet. They're fine. So because we're talking about cardiovascular disease, it's good to review those hypertension and hypotension type of scenarios, right? And this is one of the reasons why we take blood pressure on our patients before you see them. So your blood pressure is the force against which the heart must pump to perfuse the body with blood, right? Your top number is the systolic and bottom number is the diastolic. So hypertension is greater than 140/90. Of course, we know there are nuances to that. In earlier chapters, we have that list of the hypertension categories that are much more nuanced than this. But if an individual has hypertension, they have an increased risk for myocardial infarction, right? So those are things to take note of. Sometimes whenever we're doing our medical history, you make that little mental note. If a patient had high hypertension, whenever you saw them, maybe they have a history of it, they take medications for it, and then they start to have some of those symptoms that we were talking about, these ones over here, then we're going to be much more concerned for an acute myocardial infarction in the dental office. Hypotension, of course, is low blood pressure, and it's caused by blood loss or vasodilating medications, and it can lead to fainting. So hypotension can lead to one of those really common experiences of syncope in the office. So again, we take our blood pressure every time we see our patients, which is very beneficial for our patients, but it also helps us in preventing medical emergencies, and then also helps us act in the face of a medical emergency because we have more information. So, what are some other cardiac related conditions? We have a pacemaker or an implanted cardiac device, cerebrovascular accident, which is a stroke, and a transient ischemic attack, a TIA, headache, and migraines. So pacemakers or implanted cardiac devices are pretty benign in the dental setting, except for that we don't use like our ultrasonic instrument whenever they have one of those, because we don't want to interfere with the function of the pacemaker. So what if a patient has a cerebrovascular accident, the CVA, or a stroke in the dental office, right? So this could be signaled by a severe headache, visual abnormalities, confusion, slurred speech, inability to speak, numbness, or losing feeling on one side. So if we're suspicious that a patient is experiencing a stroke in our chair or in the dental setting, we're going to place them in a comfortable position, and we want their head elevated. And then we're going to talk with our patient a little bit. We're going to ask them to smile, raise both arms, speak a simple sentence, and stick out their tongue. And if they have challenges with any of those, we're going to call 911. If we have concerns with any of those that they maybe are not obvious, we're going to call 911. And we will also provide basic life support as needed. So again, sometimes we have these lists of things that we're doing, but as we know, in emergency settings, things are happening kind of all at once. You're sitting your patient up, talking to them, asking them to smile, seeing how their facial reactions are happening, how their body is moving, and then we're making that call very quickly if we need to. And if we are suspicious, like I said before, of anything, we call 911. And that is it for our cardiovascular system. So make sure that you complete your flow chart for this assignment and get that turned in by the due date. Read chapter 11 and your additional resources that are listed for the week. And let me know if you have any questions.